things have been evolving, for the past really 10 months now, right? And we've seen the first wave. We've seen somewhat of a slight lull over the summer, which still was alarming, even though it was summertime. But then second wave hit and it came on very strong. And now we're seeing the situation continue to deteriorate. External to the community throughout the province of Quebec, throughout Canada. But unfortunately, also seen numbers like we haven't seen before within the community, with number of positive cases, number of active cases, the number of people who are in isolation is concerning. We did have a good discussion on next steps moving forward, but mainly about ensuring that we change some of our messaging to the community, because we talked about a state of emergency, which has been in effect now for nearly 10 months, that it kind of loses its punch, right? To saying like state of emergency, it's kind of language that we're getting used to. We're getting too used to it. Under normal circumstances, you say state of emergency, it means a lot, But now we want to refocus a little bit with the community and say, no, we're really in a very dire situation here now. If things progress down the path they're on now. We are at a very much heightened risk of people getting severely sick. We're at a heightened risk of people dying.
So we presently have 5 active cases in the community. I can say with almost 99.9, with almost 100% certainty that the outbreak at ILC is just about done. So we've done 2 screenings of all of the residents and of all of the employees, and those screenings have been negative. So that is a really, really good development that we can announce. We have 5 positive cases, but what we're seeing is that the number of contacts from those cases is increasing with every new positive case. So what that tells us is that people are gathering. Mostly the gatherings are happening amongst families because, and it's normal, we feel safe. We tend to feel safe when we're with our families. We know that we don't want to hurt, there's no one that wants to hurt someone else or wants to transmit the virus, but we can do so without knowing. So that's where we're seeing the most contacts happening.
People are talking a lot about the vaccine coming. Some people think, well, okay, vaccine's coming, so let me get a little more complacent and whatever. But now it's just the opposite. We're at a very critical time where we have to really ensure people understand where we're at, the risk to our community, and that we're going to have to be, remain vigilant. And one of the biggest areas, and given the holiday season that's coming, we know people want to be with family and friends. We did put out a bunch of recommendations how that can be done safely. Obviously, only your household is still the safest. But if you're going to have one other household, again, there's safety measures that should be in place to ensure that you're minimizing the possibility of spread of the virus.
We try to give safe ways to do so by always maintaining distance. Even if you have another household in your home, that you maintain distance, you wear masks when you're not eating, you eat at different tables. Do everything that you have to do to be able to respect the measures within your home so that you can all be safe. And if someone happens to be contagious, well, at least you won't be transmitting it to 8 or 10 people. You may just transmit it to those living in your home. There also have been some questions about people who live alone. Anybody who lives alone can go to another household, and that stays the same during the holiday period. But it's not an extra household that is allowed in a home. So it means that you still can only have 2 households at a time. Anytime you go up to 3 households within your home, that's considered a gathering, and that goes against the directive, and therefore is subject to fines if there is a complaint made.
We didn't want to stop any visitation like Quebec did, because we understand Kahnawake is unique. We're all close-knit here. We're all in close proximity to one another, and it's very difficult to say, well, I'm not going to see him, a family member during the holiday season. And so it honestly it is a calculated risk. It's for the mental health and well-being of our community members, allowing them some little bit of flexibility. But keep in mind that also increases the possibility or the risk of transmission of the virus. It's everybody's individual choice, on what level of risk they're prepared to take amongst their household, and have that discussion with your family on what you want to do. Because It has shown that the largest spreader of the virus is family households and getting together, over the past few months.
So actually, we've reached our capacity in Quebec for testing per day, and our positivity rate right now is 5%, whereas in the middle of the summer, the positivity rate was 1%. So this is not just an increase in number of cases because of an increase in testing. This is an actual increase by 4% in number of positive cases of those being tested. So that's huge, and that's having an impact on our community as well. Many of the cases that we have now, we can't determine origins, so it could be from groceries or just from going out and about.
We actually had a discussion with Dewadun Zakta on the issue about if we have to either resort to closure of additional industries or businesses or take stronger measures, that we want to make sure that the business community has the opportunity to prepare for whatever changes may come. We sent out an initial notice in early November. We issued it again yesterday, just to remind people that we will give notice if that's the case, as well as reminding them of the existing measures, that it's important that they themselves relook at their business, so to speak, and how are they operating, and ensure that they are being extra vigilant themselves, and being safe, to put that reminder out there. As well as a reminder, we have Directive 51, which is to ensure that if anybody within your business operation is tested and comes back positive, that you must notify Kahnawake Local Public Health, because there are people who don't reside in the community or may have go outside the community for testing. If somebody is in this community for work purposes or any other purposes, they must notify the local public health team, so we could do proper contact tracing inside our community to identify possible contacts as quickly as possible and isolate them, and so that we minimize any spread. It's going to be a long winter. January and February, have a potential of being some of the toughest months that we've seen throughout the pandemic, due to numbers and cases, but also because it's the dead of winter. There is, some light at the end of that tunnel. We know that the vaccine has been gradually starting to roll out throughout the province of Quebec and throughout Canada, and it will eventually come into the community.
Right now, we're talking about two vaccines. There's the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine prioritization is going to be for healthcare workers. There is a very specific reason about why that is the case, and it's because the Pfizer vaccine cannot be moved. Once it's brought to a location, it has to stay there. So even remote communities that possibly should be, and definitely should be prioritized, are not with the Pfizer vaccine. So the rollout is going to happen here in Kahnawake very shortly, probably next week. By the end of this week, we'll have a lot more details. But we already are in the preparation phase for that Pfizer vaccine. But again, because the vaccine can't move, we have to go to it. Wherever it's dropped off in the Montérégie area is where our healthcare workers will have to go to be vaccinated. The Moderna vaccine, which should be approved in the coming days, is a little bit different. That vaccine will be delivered most probably to the federal government, and then they will have the responsibility to distribute. And that vaccine can be moved more easily. So the rollout is going to happen. Priority is always going to be the most vulnerable, so long-term care facilities, intermediate resources, family-type residences where people are very vulnerable. With respect to First Nations communities, it's still up in the air. So we are hearing mixed messages. Some are saying First Nations communities will be prioritized. Others are saying, using more of the terminology where it's remote communities that will be prioritized. So we still don't have very much information about that, apart from knowing that the long-term care facility residents are definitely first, and the health and social service workers as well. After that, it kind of will go by age. So we're still First Nations communities, teachers. There's still a lot of ambiguity about those populations within the prioritization scale. Moderna vaccine should be approved in the coming days. We expect to see a rollout for that either late December, early January. But again, the information, I'm in meetings almost daily. The information changes as often as I'm in meetings. So until we have confirmation and clear, accurate information, we can only speculate about what's coming. Kahnawake is part of the CIS Montérégie West. And so they're the people that we're in constant discussion with about the rollout. And we're very involved. So I think it's important for the community to be aware of that. Even though we don't have a lot of information to give, we are involved in every step of the rollout and distribution process. We definitely will distribute the vaccine within our own community. So the vaccine will be administered here. But again, there's no details or about the logistics about that just yet.